Let me ask you something very direct. Do you know your blood type? Most of you do. And if you don't, you probably think it doesn't matter very much. That it's just a piece of information for blood transfusions or maybe organ donation. Something the nurses jot down in a chart and never mention again. But here is what nobody is telling you. I want you to let that sit for a second. According to a landmark study published in the journal Arteriosclerosis, Thrombosis, and Vascular Biology, a peer-reviewed publication, not a wellness blog, individuals with blood type A, B, or AB carry a significantly elevated risk of developing coronary artery disease compared to those with blood type O. We are talking about a 23% higher risk of heart attack in non-O blood types. 23%. A separate study out of Harvard Medical School, Harvard, not some fringe institute, followed over 90,000 participants for more than 20 years and found that people with blood type AB face up to a 23% higher risk of heart disease. Blood type B individuals have an 11% elevated risk, and type A individuals carry an 8% elevated risk. But here's the part that should make the hair on the back of your neck stand up. 1 in every 3 adults in the developed world has no idea that their blood type is silently influencing their cardiovascular risk, their clotting cascade, their inflammatory baseline, and even their gut microbiome composition. Right now, today. While they're eating the same generic diet, taking the same generic supplements, and following the same one-size-fits-all lifestyle advice that their doctor gave them in a 7-minute appointment. This is not a heart problem. This is a biology being ignored problem. Stay with me, because in the next 25 minutes, I'm going to walk you through the documented physiological mechanisms by which your blood type shapes your risk profile, debunk one of the most dangerous myths in preventive medicine, and give you a specific, evidence-informed protocol that is calibrated to your actual biological identity, not some theoretical average person. Now, why isn't your doctor sitting you down and having this conversation with you? I've been practicing functional and integrative medicine for over 15 years. I've sat across from thousands of patients, and I can tell you from direct experience that the standard healthcare model is not built around preventing your disease. It is built around billing codes. There is no billing code for we discussed your ABO blood group antigen profile and its effect on your von Willebrand factor levels. There is no insurance reimbursement for sitting with a patient and going through their genetic cardiovascular risk in the context of their blood type phenotype. There is no revenue stream for the conversation I am about to have with you right now. Nobody in a white coat is going to tell you this. Not because they don't care. Most physicians went into medicine because they genuinely want to help, but because the system they operate in does not incentivize prevention. It incentivizes procedures. It incentivizes prescriptions. It incentivizes return visits. A healthy patient who never gets sick is, from a revenue standpoint, the worst possible outcome for a healthcare system built on treatment. Think about it this way. You're not walking through the front door of your doctor's office as a person with a unique biological identity. You're walking through as a series of symptoms to be matched to a drug or a procedure. You are being treated like a fire that needs to be put out, rather than a forest that needs to be cultivated. And your blood type? It doesn't even come up in most annual physicals. It sits in your chart, completely unused, while your physician writes you a generic prescription for a statin or blood pressure medication that was tested on a population that may not share your biological risk architecture at all. This is not a theory. This is a documented systemic failure of preventive medicine. Before I go any deeper into the science, I need to ask you for something. This channel exists for one reason: to give you the information that the system won't. We are working toward 100,000 subscribers, people who are done being passive participants in their own health. And every single person who hits that subscribe button and rings that notification bell is someone who has decided to take back control of their biology. If you are getting value from what I'm about to share with you, please subscribe right now. Hit the like button. It takes 3 seconds and it tells the algorithm that this kind of real, evidence-based content deserves to reach more people. Not just followers, not just views. Real people who need this information. We are so close. Every single one of you counts. All right, let's get into the science. Your ABO blood type is determined by antigens, specific protein and sugar molecules that are expressed on the surface of your red blood cells. These are coded by the ABO gene on chromosome 9. But here's where most people's understanding stops and where the real story begins. These antigens are not limited to your red blood cells. They are expressed throughout your body, on the endothelium, which is the thin single-cell layer that lines every single blood vessel in your body, on your platelet surfaces, in your saliva, in your gut lining, and even in the secretions of your gastrointestinal tract. The endothelium is critical here. Think of it as the wallpaper inside your arteries. When it's healthy, it is smooth, flexible, anti-inflammatory, and anticoagulant. It releases nitric oxide, which dilates your vessels and keeps blood flowing freely. When it is damaged, as by inflammation, by oxidative stress, by chronic cortisol elevation, it becomes sticky, permeable, and pro-inflammatory. This is called endothelial dysfunction, and it is the very first step in the atherosclerotic cascade that ultimately leads to heart attack and stroke. Now, here is the blood type connection that nobody in a standard cardiology office is explaining to you. Blood type directly modulates your levels of von Willebrand factor, or VWF, a large glycoprotein that acts as a molecular glue in your clotting cascade. It carries factor VIII, protects it from degradation, and mediates platelet adhesion to damaged vessel walls. Studies consistently show that individuals with blood type O have naturally lower levels of von Willebrand factor, typically 25 to 35% lower than non-O blood types. This is because the ABO antigens on VWF in type O individuals make the protein more susceptible to cleavage by a circulating enzyme called ADAMTS13. What does this mean clinically? It means that type O individuals have a lower baseline tendency toward arterial thrombosis, the kind of dangerous clot formation that causes heart attacks. They bleed a little more easily if injured, but their arteries are less prone to the sticky, clot-forming environment that triggers cardiac events. Type A, B, and AB individuals have structurally different VWF molecules that are more resistant to ADMTS13 cleavage, resulting in higher circulating VWF levels and a measurably more prothrombotic internal environment. But the cardiovascular story is only the beginning. Your blood type also shapes your inflammatory baseline through a mechanism involving lectins, proteins found in many foods, especially legumes and grains, that bind to specific sugar molecules. Here's something almost no one is talking about. Certain dietary lectins can bind preferentially to ABO blood group antigens in the gut lining. This creates an immune response, a cascade of interleukin signaling, and localized inflammation that, over years and decades, contributes to intestinal permeability, what we commonly call leaky gut, and systemic low-grade inflammation. Your blood type also correlates with significant differences in gut microbiome composition. A 2020 study in Microbiome Journal demonstrated that ABO secretor status, whether or not you secrete your blood type antigens into bodily fluids, has measurable effects on the diversity and species composition of your intestinal flora. This, in turn, affects everything from your short-chain fatty acid production to your immune regulation to your neurotransmitter synthesis via the gut-brain axis. The vagus nerve, the great information highway running from your brainstem down through your heart, lungs, and gut, is deeply influenced by this gut-brain signaling. Chronic gut inflammation, driven in part by blood type incompatible dietary patterns, can suppress vagal tone. Low vagal tone means impaired heart rate variability, elevated baseline cortisol, reduced immune regulation, and increased risk of depression and anxiety. You are not eating food. You are having a conversation between your blood type and your nervous system 3 times a day. The oncology data is equally striking. A meta-analysis published in PLOS One found that blood type A individuals have a statistically significant elevated risk of gastric cancer, stomach cancer, compared to blood type O. The proposed mechanism involves Helicobacter pylori, the bacterium responsible for most stomach ulcers. H. pylori binds more readily to the A antigen present in the gastric mucosa of type A individuals, creating more durable colonization and greater mucosal inflammation over time. Blood type AB has been associated with elevated pancreatic cancer risk in multiple large cohort studies. Blood type O, meanwhile, appears protective against several solid tumor types, potentially due to lower chronic inflammation and more robust immune surveillance at the endothelial level. This is not a blood type problem. This is a personalized medicine problem, a failure to use the most basic biological identifier we have to tailor preventive care. Now, I need to address something directly, because this topic comes with a lot of baggage. You may have heard of the blood type diet, the popular theory popularized in the late 1990s that prescribes very specific food lists based on ABO type, with claims ranging from weight loss to disease reversal. The idea was that lectins in food react specifically with your blood type antigens, and that eating the wrong foods causes agglutination, clumping of your red blood cells. I want to be very clear about this because intellectual honesty is non-negotiable in this space. The original blood type diet has a rigid prescriptive system has not been validated by rigorous clinical trials. A large 2013 systematic review published in the American Journal of Clinical Nutrition examined all the available evidence and concluded that there is no evidence to validate the proposed health benefits of blood type diets. Full stop. The agglutination claim that food lectins specifically agglutinate red blood cells in the bloodstream based on blood type is not supported by the available evidence because most dietary lectins are denatured by cooking and digestion before they ever reach the bloodstream in quantities sufficient to cause systemic agglutination. This is clinically false as a mechanism, and I am not going to pretend otherwise. However, and this is important, dismissing the blood type diet entirely has caused many people and many clinicians to throw out something genuinely valuable. The established, replicated, peer-reviewed science showing that ABO blood type is a real, measurable modifier of cardiovascular risk, inflammatory baseline, microbiome composition, and cancer susceptibility through completely different, well-understood mechanisms. The myth is the specific dietary mechanism. The reality is the epidemiological risk pattern and the vascular physiology. Do not let a discredited mechanism cause you to ignore a documented reality. These are two separate questions, and conflating them is bad science. So what do you actually do with this information? Let me give you a specific, actionable protocol that anyone can implement today, using nothing more than what you likely already have in your kitchen. I call this the ABO Cardiovascular Recalibration Protocol. It is built on 3 pillars: endothelial support, inflammation modulation, and microbiome optimization. And it is calibrated for non-O blood types specifically, though the core elements are beneficial for everyone. Step 1A. 30 minutes before breakfast, prepare the following: 200 ml of cold water, the juice of half a fresh lemon, approximately 15 ml, and 5 g of raw, unprocessed beetroot powder, available at any health food store for under $10. Stir vigorously and drink immediately. Do not eat for 30 minutes after consumption. Why this works: dietary nitrates in beetroot are converted by oral bacteria, specifically the nitrate-reducing bacteria on your tongue, into nitrite, which is then converted by the acidic environment in your stomach into nitric oxide. Nitric oxide is the most potent endogenous vasodilator your body produces. It relaxes smooth muscle in your arterial walls, reduces endothelial adhesion molecule expression, and directly counteracts the prothrombotic vascular environment associated with elevated VWF in non-O blood types. The lemon juice serves a dual function. The citric acid optimizes your stomach pH for nitrate to nitrite conversion, and the vitamin C content helps regenerate glutathione, your master antioxidant, which protects the endothelial glycocalyx from oxidative degradation. Step 2A. If you are blood type A or AB, soak all dried legumes, lentils, chickpeas, kidney beans, for a minimum of 12 hours in cold water before cooking. Change the water twice during soaking, Then pressure cook for a minimum of 15 minutes. This protocol denatures the most problematic dietary lectins, specifically phytohemagglutinin and agglutinin, by approximately 97%. Step 2B. Avoid or significantly reduce raw tomatoes and bell peppers if you are blood type A. These contain lectins that have demonstrated preferential binding to A antigen structures in vitro studies. Cooked tomatoes, particularly slow cooked, present a substantially lower lectin burden. Perform this every morning 60 seconds total before coffee or stimulants. Step 3A. Breathe in deeply through your nose for exactly 4 seconds. Step 3B. Hold at the top for 2 seconds. Step 3C. Exhale slowly through pursed lips for 8 seconds. The extended exhale is what activates the parasympathetic vagal response. Step 3D. Repeat this cycle 6 times. Total time, approximately 85 seconds. After the breathing cycle, hum audibly, for 30 seconds. The vibration of humming directly stimulates the vagus nerve at the laryngeal branches, which increases vagal tone measurably within minutes. Studies using heart rate variability measurement have documented this effect. This is not wellness mysticism. This is neurology. Each evening, 45 minutes before your last meal, prepare the following: 250 milliliters of warm water, not boiling, but approximately 60 degrees Celsius, 1 teaspoon, approximately 4 g, of raw cacao powder, minimum 70% cocoa solids, half a teaspoon, approximately 2 g, of Ceylon cinnamon, not cassia cinnamon, which contains coumarin at levels that are hepatotoxic in chronic use, and a quarter teaspoon, approximately 1.5 g, of turmeric powder, with a tiny pinch of black pepper, which increases curcumin bioavailability by up to 2,000% via piperine-mediated inhibition of glucuronidation. Stir and drink slowly. This tonic delivers epicatechin from the cacao, a flavonoid shown to increase eNOS enzyme activity and nitric oxide production in endothelial cells, along with curcumin, which is one of the most studied natural NF-κB inhibitors, reducing the inflammatory cytokine cascade that drives endothelial dysfunction. If you are blood type AB or AB, take 2 g of high-quality triglyceride form omega-3 fish oil, EPA minimum 600 mg, DHA minimum 400 mg, with your largest meal of the day, not on an empty stomach. Fat-soluble nutrient absorption is dramatically improved in the presence of dietary fat. Omega-3 fatty acids, specifically EPA, compete with arachidonic acid for incorporation into platelet membrane phospholipids and directly reduce thromboxane A2 synthesis, lowering platelet aggregation. This is a direct physiological counterweight to elevated VWF activity in non-O blood types. I want to tell you about a patient. I'll call him Marcus, not his real name, but his story is entirely real. Marcus came to my practice at age 54, blood type A positive. He had already had 1 cardiac stent placed 2 years prior after a mild heart attack that his cardiologist described as unexpected given his otherwise unremarkable lipid panel. His total cholesterol was actually within acceptable range. His blood pressure was borderline, but medicated and controlled. On paper, he looked like someone who should not have had a heart attack. But when I looked at his full picture, and this is where functional medicine differs from the standard model, I saw a man with chronically elevated von Willebrand factor antigen at 182% of normal, persistently elevated high-sensitivity CRP, indicating systemic inflammation, impaired heart rate variability, suggesting suppressed vagal tone, and a gut microbiome profile heavily depleted in bifidobacterium and Faecalibacterium prausnitzii, both of which are critical anti-inflammatory commensals. He was eating what he thought was a healthy diet. Lots of whole grains, beans every day. Undercooked, as it turned out, raw tomatoes in his daily salad. He was exercising. He was taking a standard fish oil supplement at the wrong dose, at the wrong time, in the wrong form. We implemented a version of the protocol I just described. Not a single prescription changed, not one. We simply recalibrated his life around his actual biological identity. Within 6 months, his VWF antigen dropped to 134%. Still elevated, because that is partially genetic but substantially improved. His HSCRP went from 3.8 mg/L to 1.1 mg/L. His heart rate variability, measured by his wearable, improved by 40%. He lost 8 kilograms without trying to lose weight. And he told me, at his 9-month follow-up, that he felt like himself for the first time in a decade. Marcus didn't need a new drug. He needed someone to actually look at who he was, biologically. He needed the conversation that no billing code had ever paid for. Now I want to hear from you. Want to drop 2 things in the comments below. Your blood type, if you know it, and your age. Because the protocols I design, the content I create, the interventions I discuss, they need to match where you are in your biological life. A 34-year-old with blood type B has a completely different risk horizon than a 61-year-old with type AB. How old are you? Drop your age in the comments right now. It takes 5 seconds and it helps me tailor every future video to your actual physiology, not some imaginary average viewer. I read every single comment. This is not a bot response channel. I am here. Let me bring this home. Here's what we covered today. Your 5 to 7 key takeaways. Your blood type, specifically ABO, modifies your cardiovascular risk through real, documented physiological mechanisms, including von Willebrand factor levels, endothelial antigen expression, and platelet aggregation tendency. This is not alternative medicine. This is vascular biology. The healthcare system, as currently designed, does not incentivize the use of this information for prevention. It is structured around treatment, not wellness. You must become your own informed advocate. The popular blood type diet as a prescriptive food plan lacks clinical validation. But the dismissal of blood type as a health modifier is equally wrong. The risk stratification data is real and replicated. The morning nitric oxide primer, beetroot powder, lemon water, 30 minutes before breakfast, directly supports endothelial function and counteracts prothrombotic vascular biology in non-O blood types. The vagal tone activation sequence, 4 to 2 8 breathing plus 30 seconds of humming, is a neuroscience-backed intervention for improving heart rate variability and reducing chronic sympathetic dominance. The evening tonic, cacao, Ceylon cinnamon, turmeric, black pepper, and warm water, delivers evidence-graded endothelial and anti-inflammatory support from your kitchen shelf for under $15 a month. Omega-3 supplementation in triglyceride form, timed with your largest meal, at a therapeutic EPA-DHA dose, directly modulates platelet aggregation. The form, the timing, and the dose all matter, and most people get at least 2 of the 3 wrong. Your blood type is not your fate. It is a map. And a map is only useful if someone is willing to read it with you. Honestly, completely, without a financial incentive to keep you sick. The system profits from treatment. I profit from you not needing me anymore. That's the difference. And that is why this channel exists. Share this video with someone who needs to hear it. Subscribe if you haven't already. And I will see you in the next one, where we are going to go even deeper into how your blood type interacts with your stress hormones and your cortisol clearance rate in ways that the standard endocrinology world hasn't caught up with yet. Take care of yourselves. I'll see you soon.